Hi there. Are you suffering from weight gain, tiredness, hair fall? Have you been wondering yourself about the thyroid gland related problems? So you are not alone. So this is one of the most common questions which people ask us regarding their thyroid gland. So in this video, I'll be highlighting mainly about the basics of thyroid gland, what it is, what are its normal function, what are the common tests we doctor do, and how to suspect a thyroid gland related disease. So let's start with the basics. Thyroid gland is one of the endocrine glands situated in front of the neck. It's usually in a butterfly shape. Thyroid gland has two lobes. One is right lobe and second is left lobe. These two lobes are connected by a bridge known as isthmus. The main function of thyroid gland is to manage the body's metabolism. Metabolism means converting food into energy. Basically, the thyroid gland produces hormones, two important hormones known as T3 and T4. T3 stands for triiodothyronine and T4 stands for thyroxine. The purpose of these hormones is to control the body's metabolism. Thyroid hormones are required to maintain our body's temperature, to maintain our energy levels, and in children to help them to gain height as well as weight. This thyroid gland is also regulated by the main gland known as pituitary gland. This is a master gland which is situated in our brain. You can see in this picture that the pituitary gland produces a hormone known as TSH, which stands for thyroid stimulating hormone. This TSH acts on the thyroid gland and makes the gland to produce T3 and T4. So this T3 and T4 controls our body's metabolism. Normally, the thyroid gland produces right amount of hormones so that it keeps our body's health in a perfect balance. Sometimes when this balance is disrupted, thyroid disease can manifest. Now let us see what are some of the common types of thyroid diseases. The most common thyroid disease is hypothyroidism, hyperthyroidism, goiter, thyroid nodule, thyroid cancer. Let me discuss briefly about these diseases. Hypothyroidism. This is one of the most common form of thyroid disease. Hypothyroidism stands for underactive thyroid disease. Hypo means underactive. So the thyroid gland here is underactive. Thyroid gland is not producing sufficient amount of hormones required for the body. Person suffering with hypothyroidism can have various symptoms like tiredness, weight gain, hair fall. Apart from this, he can have swelling in the body, his heartbeat comes down, constipation, dry skin, puffiness around the eyes. So these are some of the symptoms of hypothyroidism. Now let's move on to next thyroid disease, that is hyperthyroidism. Hyper refers to overactive. Here the thyroid gland makes excessive amount of thyroid hormones than required by the body. Here the symptoms are exactly opposite of hypothyroidism, that is weight loss, hair fall, sweating, increased heartbeat, anxiety, loose motion, tiredness. All these are symptoms of hyperthyroidism. Goiter. Goiter refers to enlargement of your thyroid gland. Previously, like 30, 40, 50 years back, when there was deficiency of iodine mineral in our body, you would have seen in pictures or in videos, there was an enlargement of this swelling in front of the neck. This is known as goiter. Nowadays, it's less common. Now, I'll be talking about nodule present in the thyroid gland. In this picture, you can see that there is a small growth in the thyroid gland. So this growth is known as nodule. You would have got a ultrasound scan of your neck and found out, sometimes you would have found out that there is a small growth in the thyroid gland. Usually it's benign or it's non-dangerous, but in a small proportion of these nodules can be dangerous or become cancerous also. So we need to evaluate further to see if it is dangerous or is it a benign condition. Finally, let's talk about thyroid cancer. Cancer refers to unwanted growth. Here there is an unwanted excessive growth in the thyroid gland. So if a person has thyroid cancer, it has to be removed by doing the neck surgery known as thyroidectomy or total thyroidectomy. Here the entire thyroid gland is removed. So these are about the basic thyroid diseases, tests to diagnose thyroid related problem. You would have heard about these tests. There are three important blood tests with respect to thyroid gland diseases. One is TSH, second is T3 and T4. TSH stands for thyroid stimulating hormone, T3 and T4. These are the common simple blood tests which is available in almost every laboratories. So if at all you are experiencing the symptoms which I have mentioned before, you should talk with your doctor and get these tests done. By doing these tests, we'll come to know whether you are having hypothyroidism or hyperthyroidism, or your thyroid gland functions are normal. Apart from blood test, we also have other tests known as ultrasound of your thyroid gland, commonly known as USG thyroid. Here, the radiologist does a scan of your thyroid gland. Basically, it's like taking the black and white picture of the thyroid gland. By doing the scan, we'll come to know about the size of the gland. Is it bigger, normal in size, or is it smaller? We also come to know whether there are any nodules or there are any tumorous growths in the thyroid gland. It gives us an overall idea about the shape and structure and size of the thyroid gland. So this is about the ultrasound of thyroid gland. Thirdly, we have a test known as FNAC, which refers to fine needle aspiration cytology. Sometimes if a person has a nodule or some growth, we might need to see what does this nodule contains. Does it contains any harmful cells? Does it contains any cysts or water? To know this, we do this test known as FNAC. A small needle is inserted into this nodule, few cells are taken and looked under microscopy to decide whether it is dangerous or is it a benign one. So these are about the tests of thyroid gland. To summarize, thyroid gland is a simple, small, butterfly-shaped gland situated in front of our neck. This gland produces hormones, which is required to maintain our body's metabolism. People with thyroid disease can have hypothyroidism, hyperthyroidism, or any growth in the gland. There are common tests like TSH, T3, and T4 to know whether you have thyroid disease. And in some scenarios, we do get additional tests known as ultrasound thyroid, and in some of other indications we ask the people or the patients to get FNAC of the thyroid nodule. So with this, let me highlight you that if at all you are suffering from tiredness, weight loss or weight gain, hair fall, low mood, anxiety, thyroid related disease can cause all these symptoms. Kindly meet your doctor and discuss about these symptoms and get yourself tested for thyroid gland. With this, I'll end my video. Once again, thank you for watching this video. See you soon with subsequent videos. Thank you.